Not yet, I'm afraid, Andy.
Yeah, I find it's a bit frustrating. Sometimes I can get this to work, and sometimes it can't for some unaccountable reason.
Andy, do you want me to try?
If you can, Dale, that'll be fine.
We're waiting, Mary. That's the meeting now recording, just to let everybody know that's in place now.
Oh, we're getting somewhere.
All right.
That's it. It's there.
Okay. Thanks, Dale. Right. I think first off, I should sort of preface things by saying.
I'll use Babs' room.
Sorry? To everybody that's mute their mic.
One moment. Could I ask those who still have their, apart from Andrew, could you switch off your microphone, Mario, and your camera, please? Thank you. So carry on, Andrew. So.
Okay, thank you. Yes, I think I should preface this by saying that none of this is easy. You won't find it easy, and we don't find it easy. But all I can say is that you can be assured that we will work with the trade to assure as far as possible that you get the necessary advice to meet your responsibilities. So first up, you'll probably be aware of, no doubt you'll be aware of the regulations that have been ongoing in the last few weeks and months. So I'll speak very briefly about the current guidance, the new mandatory guidance or mandatory guidance, advice and support and enforcement. Just to forewarn you that there's mandatory guidance coming out on Friday, which will sort of reinforce the current controls. Hopefully what I'm going to speak about won't stray too far from what is coming in. I would imagine that the general principles are still the same. Okay. So first of all, there's a requirement for physical distancing, which is still the default of 2 meters between households. Now, in the hospitality sector, this can be reduced to 1 meter if you put in the appropriate mitigation measures. In terms of groups of people that can come into the hospitality sector, you're allowed a maximum of 8 individuals from the households indoors. And no doubt you'll appreciate this is very difficult to control. And if you're having separate households, they must either have a distance of 2 meters or 1 meter, dependent on the controls you can put in place. So this is a diagram of scenarios for physical distancing. You've got one single party that can have no distancing in between it. That's a single household. You can have 2 households with 1 meter spacing, and then you can have 3 households with 1 meter spacing. So I think that sort of flags up the complexities of all this. And again, the physical distancing must be maintained by all the individuals throughout the premises, not just those seated. So you'll have your walkways and your gangways that have to be considered for distancing. Of course, you get access to the toilets, so that has to be put into play as well. You also have to consider that the toilets and hand washing facilities are managed and to ensure that there's proper management of those facilities. Again, here's a diagram that kind of indicates what you would need to have in place. So this would be your seated areas, this would be your walkways, your clear areas. Customers would have to maintain a 1 metre distance down the middle of these clear areas. The second diagram here shows a setup with physical barriers in between the parties. Somebody with more brain cells than I have has put this together. So. Also need to think about in regard to queuing outside your premises. You have a single household party, and then you'd have to have 2 meters distant to the next household party, and so on and so forth. You also have to think about your maximum capacities. I mean, this should be your first up consideration. How many people can you get in your premises? How are you going to plan it out to allow the makeup of the parties? How's your staffing going to interact with the customers? How will your customers and staff be able to use the toilets and hand washing facilities? I mean, that may govern how many people you can allow into the premises, how many toilets can you make available for use safely. So if you're thinking about reducing your distancing to 1 metre, you have to have an appropriate mitigation measure, which is face coverings for all staff that interact with customers, unless there's a physical separation. All your customers have to be seated. You have to think about the current ventilation and what you need to do to improve it. You keep any amplified music and TVs to a reasonable level to reduce the need for raised voices. And you have to have the appropriate signage that indicates you're in a 1 metre distancing situation. You also have to think about appropriate cleaning and disinfection and customer contact information. That is very likely to be part of the mandatory guidance coming out on Friday. If you are collecting and keeping customer contact information, you have to do that for 21 days. Yeah, as I mentioned, the mandatory guidance is coming on Friday, and it's likely to include, as I said, the contact detail requirements, pre-booking of tables, non-standing of customers at the bar. Possibility of face coverings for customers for not eating and drinking. So first up, our primary role in all this is to help you meet your requirements. And to do that, we engage with you, provide the tools and materials towards helping you do that. So that's the requirements, is engage, educate, enforce. You probably be aware that we have been visiting licensed premises, hospitality premises throughout the city in the past few weeks, providing the guidance that you need to meet your responsibilities. Here are sources of advice and support: the Scottish Government website, our own website. If you need support and advice, you can do that through our website. You will no doubt be aware of seminars in the hospitality industry. And as I mentioned, if you're looking for advice from us, we can certainly come out and do that physically and by officers visiting. don't want to get too heavy on this. This is the enforcement measures. If ultimately you fail to comply with what's required of you, there are various options open to us. Under the regulations, we can issue prohibition notices if you're trying to require with the physical distancing. Also have health and safety powers, health and safety at work powers, prohibition notices and improvement notices. We can take action where there's applications for occasional licences, where we think that the premises are failing to comply with the licensing requirements. There are current temporary situations in the city centre, like these public spaces. Conceivably, those permissions could be revoked. And ultimately, if you've got a licence and we're aware of contingent non-compliance, very possibly we could ask for a review of the licence. Also, there may well be further enforcement powers with regards to when revisions to the regulations occur. And that's it. Hopefully that explained things, albeit in a brief manner. Explain the position where we are. Is there any questions? Dale, do you want to add anything to that? Have I missed anything or misled anybody?
No, I don't think so. I think, as you said at the start, it's very difficult. The guidance is changing. There's mandatory guidance coming in. We don't know what it is. If we did, we could tell you. So it's probably going to be the same as what you've been required to do so far. And we are here to give advice. I will add that. We're more than happy to come out to businesses and to give advice face to face.
And again, I would emphasise, having spoken to Andrew Morrison earlier, that there will be seminars being set up by environmental health you'll be able to sign up for. So thank you. Apologies, there seems to be a bit of a crackle on the line. I'm hoping everybody's catching what Andrew's said. Yeah, you're a bit crackly. I'm sorry, Andrew.
All right, okay.
Okay. The next person we have to talk about in terms of responsibilities with COVID is Police Scotland. Are you there? I'm not seeing Sergeant Flett. Oh no, Sergeant Flett's turned into, I think is it Inspector Campbell?
No, it's Chief Inspector Dave Howison, and I am joined by Sergeant Flett in the room, but we're socially distanced, so she's off to one side here. We only have access to the one terminal with Teams on it, so apologies for that.
No problem. I'll just hand over to you. Thank you.
Okay, thanks. Yeah, I'll know a good number of people on the call, I'd imagine. Likewise, Jill will probably know a greater number, to be honest. I'm Dave Howison. I'm the local area commander for the south of Aberdeen City, which includes the city centre. I've got responsibility for territorial policing, if you like, within the city centre. So the uniformed officers who are hopefully very visible to you at all times, not least just now when we're dealing with such a difficult situation. I would certainly reflect on what's been said earlier in the meeting, that this is an extremely difficult situation for everyone, and I include our own agency in that. What we have endeavoured to do so far is to support the wider public health efforts in being visible, in engaging with the public, engaging with you as the licensed trade and our partners within the local authority, to give guidance where we can, to, as a last resort, take the enforcement measures that are available to us. And hopefully the relationship hasn't changed massively between the police and the licensed trade. That's always been something that we've endeavoured to do, is to be visible within the city and to support to support your staff and to support your patrons to create as safe an environment as possible. We are waiting, as everyone else is, to find out what the revised guidance will be from the Scottish Government at the end of this week, and how much of that guidance will make its way into legislation. And that will influence, to a degree, what we are able to do. But our strategy won't change. We will be visible, we'll be working alongside our local authority and health partners, and we'll be working alongside you as a licensed trade. I'd expect my officers to remain visible to you, to pay visits to the premises in a supportive manner, to assist your staff with situations that are contentious and maybe require a little bit of support, to engage with patrons if we observe things that don't appear to fall within the guidance as is known to us, and to encourage compliance with that guidance. And in the hope that we can support you back to doing business as soon as possible, and get the city centre back on an even footing. I'm quite happy to answer questions when the appropriate time comes in the meeting, but that is a very quick run through of what the policing strategy is, of what the policing tone will be, and the way in which the teams within the city will try and support you through this difficult time. Is there anything, Jill, that you want to add further to that?
No.
Okay, thank you very much for that. And I think we're all agreeing that we're all in uncharted waters, and we're all, I think, finding our way through this pandemic and this kind of lockdown. So thank you very much for your input at this stage. We're moving on now swiftly to Chris Littlejohn from the NHS, who will provide us a better understanding of track and trace, because I think there has been a lot of uncertainty on how it works, and also he'll be able to maybe give you more information from a health perspective. So if I could ask Chris Littlejohn, please.
Thank you, Councillor Bolton. Hello everybody, good afternoon. I'm Chris Littlejohn, Deputy Director of Public Health with NHS Grampian. So maybe the three things to speak about in terms of test and protect, which is the broad label I'm sure you already know, linked to contact tracing then. The three examples that I think that we've seen play out over this past week or so. So I think the three examples that we've seen are how do we manage a situation where we've got two or more known cases in one premises. So I suppose that was the bit that went out into the public domain, first of all, around the Hawthorne bar. How do we then manage a cluster or an outbreak associated with an entire sector, which I think is what we, as we came out into last week, beginning this time last week, I think we were beginning to realise that this was bigger than just the Hawthorne bar, that there was something else going on. And then the third issue, I suppose, is in relation to how do you manage an outbreak situation where it's not all happening indoors inside venues, but actually where there's public concerns about what's also happening out in the public space. And so I think that relates to the fact that when we were going into not the weekend that's just passed, but the weekend previous, when we've had the first few cases that were falling into our case management system. So as we were going into the weekend of the 1st and 2nd, Saturday the 1st, Sunday the 2nd of August, we had half a dozen cases. The Hawthorne bar was the name that was coming up in relation to that. By the time that we came through the weekend and into the beginning of last week, our numbers were rapidly increasing. And of course, a number of venues were being named by cases in terms of places they'd gone. The people were putting that out onto social media. They were telling their friends, etc. And of course, what happened over that weekend was we had all of the photographs of the crowds out in the streets queuing to get into places trending on social media as well. So the first of those, where we had initially a couple of cases associated with one venue, So the Hawthorne Bar being the named venue in this case that was out in the public domain. We've got a couple of cases. In fact, let's start at the beginning. We've got one case in a premises. So anybody that goes and gets tested across Scotland, anybody that goes and gets tested, if they come back with a positive test result, the systems are set up in such a way as that positive test result is automatically notified into the test and protect system. So it doesn't need anybody to report anything or hand anything on. It happens automatically. So simply by the fact that you've got a swab, swabbed your throat and your nose, and that swab's gone off into the laboratory. If that result comes back positive, that person's details, which are gathered at the time that the swab's taken, automatically then pops up into the test and protect system and triggers a phone call from a contact tracer. And the conversation then with the person, so I've been and gotten a test and I'm positive, I get a friendly call from a contact tracer, and as well as all of the advice and such like as to what I should do in relation to my positive test, they have a detailed conversation with me about who have I had contact with. And they want to know who have I had contact with 48 hours before any of my symptoms started, or 48 hours before I actually went and got tested if I didn't have any symptoms. So from that 48 hours right through to the 10th day of me having symptoms, then that's the period of time that's of interest, because that's the period of time when I'm likely to be infectious. So 2 days, 48 hours, 2 days before I ever develop any symptoms, before I've got any awareness that I might have caught COVID-19, I can be infectious to other people. And that's the reality. I think that we're dealing with then, is that people can be infectious without knowing it 2 days beforehand. So I then provide a list of everybody that I can remember having contact with, and any places where I've been during this period of time. And the people that I've named then, they all get a call. So there's a process of assessment that's gone on with me in terms of how close did I get, are they people that live with me, are they in my household, who's my partner amongst them, who have I been within 2 meters of for 15 minutes or more, who have I been within a meter of for a minute or more without other protective measures being in place. So that's a fairly complicated and involved conversation that would be had with me as the case. And out of that then comes this list of contacts, and they would all then get a telephone call and would be asked to isolate for 14 days. Now the question then, of course, is in terms of any venues or places where I've been, what action, if any, should be taken in relation to that? And for a single case in a premises, the overarching assumption that would inform that decision making would be that premises, wherever they are, whether it's a licensed premises or not, whether it's a supermarket, whether it's a corner shop, whatever it is, the assumption would be that that indoor premises would have the appropriate measures in place, so that we would have physical distancing signs up. We might have marks on the floor to help people to keep their distance. We would be expecting people to be, in shops, we'd expect people to be wearing face masks, etc. We would expect all of those measures to be in place, so that actually the close contacts, just by virtue that I've been in a place while I'm infectious, that all of those measures are there to protect everybody, so that actually we shouldn't have a high number of close contacts simply associated with me having been inside somewhere. Once we get to the position of having 2 or more people, though, associated with the premises, it does raise the possibility then that actually maybe something has happened within the premises. And that's where the lists that you're asked to keep, and I'm aware that since last week this is now a mandatory requirement. This is where those lists come into play, because one of the options then for those managing the situation and looking at this is, yes, the test and protect will identify the contacts and have conversations with them, but actually what we might want to do then is to say, okay, so when our cases, say we've got 2 cases, we know that they were in such and such a place between such and such hours, we then need to make a decision. We can identify all the other people that were in that place at that same time. And it then requires a judgment in terms of, do we do something in relation to all of the other people that were in that premises at the same time? Now, this is not an automatic process. Like I say, we've got an assumption then that the protective measures are in place, and we've got an assumption then, an implicit or explicit assumption that those measures will actually protect people outside the close contact that person might have with household members, for example, that they've gone into the venue with. But when you've got 2 or more cases, then of course you're looking at the possibility that actually maybe something happened. So there's a bit of work to be, a bit of detective work. Do these cases that you've got associated with the venue, do they have anything else in common? Could they have given it to each other in some other venue? Just the very fact that 2 or 3 people have been in the Hawthorne bar, for example, doesn't mean that they therefore caught it from one another in the Hawthorne bar. Perhaps they all worked for the same company, and who knows, the company maybe had their summer barbecue the weekend before. So there might be, you need to look at what the alternate explanations might be. We're not going to make a jump to the assumption that just because people have been in a premises, that automatically then that's where the transmission happened. You can't do that. You need to look at the detail of it. You need to make a judgment, though, in terms of having those lists. If you make a judgment that, do you know what, that actually something's gone wrong in this particular point in time, perhaps we've got half a dozen cases and we can't find any other associations. It looks as though it's something to do with the only time they were together was in this premises. It looks as though this must be the most likely explanation. We might then want to make a judgment about those people that were in at the same time. If something seems to have gone wrong, we've got the option then to say to those people, we know that you were in the premises at the time when actually there was something going on. There were other cases there. We're going to ask you to self-isolate for 14 days as well. So the lists give us the option to be able to do that. Clearly, as we moved out of that situation of one premises being in the public eye around this, and we moved out into a number of premises being informed, and of course with the rapid increase in cases, that what we've learned, of course, is just how complex that becomes in terms of you've got 100 cases. We've got a lot more than that now, but you've got 100 cases. They've all been in a variety of premises at different times on different dates, trying to actually work out quickly who was in what venue at what time. Quickly becomes a logistical challenge to get a really clear timeline to. So in the one venue example, you can see, it becomes easier to say, okay, well, actually it was between 6 and 8 p.m. A couple of cases were in there. We can see that that's the window. Once we're dealing with multiple venues, it becomes much more challenging to say, this is the exact date, this is the exact time. And of course, for some cases, actually, they might have visited the same venue on more than one occasion in the period before they actually got a positive test. So it all becomes more complex. And so the challenge then is, and none of us would do this lightly, would be to say, and we haven't done it in this case, you'll know that we haven't done it in this case, is to say actually just simply being in a specific venue means that you are a close contact and that you have to isolate. We really would need very good evidence that something had gone terribly wrong in association with the venue before we were going to do that, because it throws up a whole range of issues and complexities, as I'm sure you'll understand. However, having the lists then adds to the possibility that if we are really worried about a runaway outbreak, that actually we do have that ability to target messages towards groups of people. Now, Now, clearly our messaging in this outbreak has been just being in one of these venues does not mean that you're a close contact. We've not gone down that line. The messaging throughout has been, if you are a close contact, you will be identified and contacted through Test and Protect. There might be some questions about that, and I'm happy to take them in the discussion session. And then I think the third bit then is, so we've moved from one premises to multiple premises to this question of, well, actually, this is bigger than premises. This is about queuing in the street. This is about crowds gathering. And I think really the lesson for this is that it absolutely shows that we are collectively in this together. That this isn't just venues, but it is about, so it's about responsible venues, but it's also about responsible citizens, but it's also about all of the authorities with all of the powers that they've got in terms of managing public crowds, managing queue systems, and I guess the potential for public disorder in and amongst potentially charged atmospheres. But I think what it does tell us is that actually it takes all of us in order to, as soon as things are reopened, it's going to take all of us collectively to keep Aberdeen safe, to stop this from happening again. And maybe just the last thing I would say, one final thing, and that would just simply be to say, I think the other bit of this is that bigger picture, the big picture in terms of course, this isn't just about people out enjoying hospitality in Aberdeen. This isn't just about people catching COVID-19 in the city centre of Aberdeen. This is about our ability in the northeast, Aberdeen City and wider, our ability in the northeast to keep moving back towards some degree of normality. So it's about our schools being able to open. It's about visiting back into the hospital, visiting inside care homes. All of these things depend on us having very low rates of infection out in the population and in the community. So in some ways, it might not seem an obvious thing in terms of whether we wear a mask in a supermarket, whether we queue 2 meters away outside a hospitality venue, as to what happens in a care home or in a school, but it is absolutely all interlinked, which is why this stuff is so important for us all to get right. Thank you.
Thank you very much, Chris. That's really helpful, because I think there was a lot of confusion over why people hadn't been contacted to hand over details that they've been collecting. So I think that's given a level of clarity for people. As I said at the beginning of the meeting, we did receive a number of points, questions, comments in advance of the meeting, because we recognise it would be quite difficult to be able to give adequate time to individuals to ask questions. So what we've tried to do is we've gone through all the comments and we've tried to theme it. And as I say, if any particular point that anybody is interested that hasn't been answered today, Steve White, as our director, has made that offer. He will circulate his email to everyone who's registered for this meeting to have further discussions, either in person when obviously the lockdown allows. So if we could kick off, obviously licensing is one of the hot topics. So, you know, there's been quite a bit of confusion around occasional licenses. So we've got Sandy Monroe, who is our licensing clerk, who will go through basically the process for occasional licenses and maybe the ins and outs around that. So Mr. Monroe, thank you.
Yeah, thanks, Mary. Yeah, in connection with a few of the comments and queries we received related to a number of the new applications or the temporary applications that were granted, and I think some of the questions around why have these been approved, etc. So I think it would be useful just to quickly run through the actual legal constraints within which the board have to work. An occasional license application when it comes into ourselves, we have to provide a copy to the police and to the licensing standards officers. They would normally have a period of 21 days in which to come back to us with any comments. In the current climate, in accordance with the guidance from the Scottish Government, they have agreed to come back to us within 7 days for those. The reason for 7 days is that at the same time that we send it to the police and the LSO, they have to be advertised on our website for a period of 7 days to give anybody the chance to make a comment, an objection or a representation or what have you. So I've seen a few comments to say that these have been rushed through, but whilst the turnaround time has undoubtedly been quicker, that's only been possible by the result of the work of the police and the licensing standards officer. They're still undergoing the same level of consultation as they would in normal circumstances. That consultation's just been taking place quicker. The public consultation is always 7 days on the website, so that has not been affected at all by the turnaround times. In terms of why are some of them granted, I think it's worth pointing out again, the legislation basically says that if the board have not received a report from the licensing standards officer or any objection or representation, the application must be granted. That's the wording in the actual legislation. So the board don't have a discretion if nothing is received during the consultation period. The legislation states that the application must be granted, and that's why the vast majority that have been granted to date have been so far, but because the applications that have been submitted have not attracted any representations or objections that haven't been able to be dealt with by way of additional conditions on the licence, in which case the representation is withdrawn. And then if there's any representation remaining, it then goes to the board, and it is then for the board to determine whether any of the grounds for refusal apply. And those grounds for refusal obviously relate to the licensing objectives. I've seen a couple of comments saying that, oh, this will have an effect on our premises or whatever. Unfortunately, that's not a ground for refusal in terms of the legislation. Similarly, people are saying there's too many. Over provision is a detail of the legislation, and it specifically excludes occasional licenses, which is these temporary ones that we're talking about, from any over provision calculation. So again, it is quite simply not something that the board can take into consideration. So that's just a brief summary of how occasional licenses have progressed, why they've been done a little bit quicker, but with that reassurance that they're still undergoing the full consultation that they would for in normal circumstances, if you like, and as I say, why they have been granted to date.
Thank you very much, Mr. Munro, and I think it's very helpful to clarify that the licensing board does act under law. It's, as you said, it's not down to their discretion. And I think it's important to say that the licensing board in Aberdeen didn't choose to use the fast track system, which some other authorities did, which then would have negated the opportunity to advertise the licenses. We felt it was appropriate and absolutely essential that people could see what was happening and have the opportunity to make their representations, either objections or whatever. So thank you very much from Mr. Munro, and I think it's also good that we had clarity over that we can't say that one person has more than another person. That's not, again, within our power to do so. Hopefully that's given a level of clarity around that. But again, we're more than happy to answer any further questions. And again, it'll probably have to be slightly later because I'll say we've got a number of questions to get through. The next one was on issues of the licensing standards report. Now, Mr. Gilchrist, we've got you down there in terms of being able to make reports on these occasional licenses to the licensing board and what reasons you would do so.
Yes. Yeah, I mean, we have to carefully put together a response within the constraints of the legislation, whether the the application fails to meet the required conditions of a license, or fails to meet one of the licensing objectives, whether it's public health or public safety, we will carefully consider that and put a response back to our licensing colleagues. I mean, sort of current scenarios are that some of these outdoor areas have attracted an increase in noise. So conceivably we would put something back questioning whether it is suitable for a renewal of that license, or a repeat occasional license would be appropriate. Hopefully that's a kind of that has addressed the question, or detailed the detailed the LSO situation.
Okay, thank you, Mr. Gilchrist. I think one thing that I just recalled a question that was on the list that perhaps Mr. Munro might like to just come back in about, and that was about when people are applying for a number of occasional licenses, why we're not issuing them all at once. Mr. Munro, would you like to answer that? I just noticed you picked up that point.
Yeah, no problem. Yeah, I mean, in terms of the board's licensing policy statement, we actually discourage a series of occasional licenses where a premises license would be more appropriate. That part of the policy statement has been waived in the current climate, just to make things again in line with the guidance from the Scottish Government, to assist businesses who otherwise wouldn't be able to operate. We're allowing people to put a series of occasional licence applications in at the same time. What we are doing, excuse me, is staggering the processing of those. The reason for that is once an occasional licence has been granted and it has a maximum of 14 days, there is no actual grounds or powers in the legislation for us to review that occasional licence. If it's a premises licence and we can take action, we can review a premises licence. There's no corresponding powers with regards to an occasional licence. So what we were keen to avoid was a situation where we had granted occasional licences, maybe 3 or 4 lasting a couple of months for a particular area, to find that after the first week, 14 days, then there was an issue with it, because we are very limited in what we can do thereafter. So the idea is to stagger this so that if any issues do come to light during the operation of the first occasional licence, then those can hopefully be looked at and the necessary amendments made or additional conditions added for any subsequent licences, or indeed considered whether it's appropriate for any more licences. So it's trying to tread the fine line between assisting businesses to operate, but also bearing in mind the sort of issues for neighbours or the licensing objectives, obviously. So it's as practical as an approach as we can come up with in the current situation.
Thank you very much, Mr. Munro. Mr. Gilchrist, I think your mic's maybe still on. Do you want to?
All right, sorry.
That's okay. It's just I can hear you crackle. Thank you, Mr. Munro. Could I? Oh, you're back on again. Thanks. Could I ask perhaps Sergeant Flett, because she obviously comes to the licensing board, if she'd like to make a comment on obviously representations or objections that the police would be making or could make to these occasional licenses under the COVID situation, because I appreciate that there has been a large number of occasional licenses, but we've only actually seen one come to the board which has had a police objection which we upheld. So if we could maybe ask the police just to comment. Thank you.
I think I'm in shot now, am I? Yeah, we have, I wouldn't like to count how many occasional licence applications we've dealt with, considering we also deal with Aberdeenshire and Moray. It will have run into hundreds by now, and we've turned them round very quickly, but we have not been negligent in giving them proper consultation. There have been very few that have gone back with the word objection in it. 99.9 have gone back as representations where we've made recommendations. In fact, a lot of recommendations were that some people were better placed, perhaps the street occupations and roads department were better placed in some regards. And as you know, Mr. Munro has said, I think just about everything that ourselves and the LSOs have recommended were by and large accepted by the applicants, and therefore there was no reason for them then to go on to require to be considered by the licensing board. So that, I think, has meant the entire process has meant it has been quicker than normal, but it hasn't lacked scrutiny because of that.
Sorry. Thank you, Sergeant Flett. I would wholeheartedly support your comments there, because knowing how diligent you are in terms of your input to the licensing board, I wouldn't expect any less. The other situation that's risen under around, I suppose, the licensing side would be actually it's to do with the use of public land. So I would ask Mr. White if you could perhaps give an answer on some of the sort of concerns about the use of the public footpaths and highways for occasional licenses and the rationale behind it.
Yeah, thanks, Mary. So I suppose the kind of role the council had played was to obviously create as much space as possible, and within that public realm, obviously there's a number of businesses that have approached the council to see if they could apply for a license. That would go to the normal licensing process and would be dealt with through that process. Obviously, we do have private land ownership, and again, if anyone approached the council, we would enter into a conversation with them around that. But in terms of the public realm, it's very much been a question of trying to help support businesses effectively get back up and running, but obviously taking into account that within that there needs to be adequate space for people to move about safely within the city centre. So generally speaking, I'm looking for I think it's about 3 meters space to make sure that emergency vehicles and things like that can get past, but trying to create as much open space for people to be able to move freely around the city centre safely, whilst social distancing or physical distancing. So that's the general sort of premise that we've worked on. But the main objective was to effectively create as much open foot space for people within the city centre, as we recognise that the likelihood of, when we came out of lockdown, that the city centre would obviously become extremely busy. One of the other challenges around the city centre, and the reason for trying to create as much space as possible as well, is that we obviously recognise that where people would tend to congregate, so basically a road junction where people are waiting to cross, they then congregate waiting for the green man to come on. So again, trying to create as much space as possible so that people can wait to cross the carriageway safely, but also allow people to walk past at a safe distance. So that's been the kind of sort of general premise that we've tried to work on. As you will appreciate, you know, Union Street, it's almost a dual carriageway going through the city centre, so it has been extremely challenging trying to find a methodology that allows us to create as much space as possible, and try and meet all the differing demands that the different businesses in the city centre have, and obviously that would be very different depending on the type of organisation that's operating within the city centre. So again, it's been trying to kind of keep that traffic flow able to happen through the city centre, but primarily everything has been driven through the public health of the citizens, to make sure that for as far as we possibly can, we create as much foot space as we can. That has to obviously be weighed up against the fact that as we try and do that, So putting plant pots, for example, I appreciate that takes away some space, but it's to try and obviously make it aesthetically pleasing, but also more importantly to try and demonstrate to people that it's okay to walk onto the road, because obviously at the beginning I live in the city centre, so I could sort of see that people were still using the pavements, didn't seem to go onto the road. So it's trying to encourage people to make as much use of the open space as they can. So hopefully that kind of gives a bit of a background to it, but it's certainly one of the most challenging things I've been involved in a long time. So, but hopefully that gives a sort of general understanding of the principles of what we were trying to achieve within the city centre.
Okay. Mr. White, I don't know if you can answer this. I'm not sure. I can't see if Mrs. Beatty's there, but and she might be able. But obviously, there's obviously the licensing part in terms of the alcohol, but there's also the license use of footways and pathways, and it's just to confirm that, you know, our teams that are involved in that, which are the roads section and also planning, have been involved in some of these occasional licenses, that, you know, all the steps that are required are taking place. And again, the other thing, and I don't think it'll be your bag, Mr. White, but it's obviously around the there was a question in and around the consent for building warrant for some of these structures. I don't know if there's somebody else maybe on the call.
I mean, Gail, I think Gail is on the call. I mean, obviously, and I'll let Gail speak more proficiently than me on this, but absolutely everybody has been subject to that kind of rigor around all of that. But I'll maybe just let Gail talk a bit more.
Gail, thank you.
Yes, thanks, Steve. I always get nervous when people say that I can speak better on those issues. I think, you know, it is really important to understand the sort of times that we are operating in. It's pretty much unprecedented, and, you know, certainly in terms of the direction that we had. So I'm in charge of both planning and building standards. Letters from Scottish Government being really clear about taking a proportionate response to any of the issues that arise, particularly around about temporary buildings and temporary structures. So we had the letter on the 29th of May, I think, round about, you know, being mindful about not pursuing enforcement action through the planning system, but then followed up just as they were emerging out of lockdown with guidance round about building standards in particular, because obviously, you know, public safety is crucially important. So I know that the guidance that came out from government saying we wouldn't be looking, would be sort of taking an informal approach to the enforcement of the 28 days for temporary structures was one thing, but the team have also been working through the list of everybody that's applied and making sure that letters have gone out reminding everybody about the safety of those structures, but also reminding that letter of comfort that came from Scottish Government only really lasts until the 30th of September, so that if people are intending to keep in these structures beyond then, there needs to be a proper application put in to deal with that. So we are very mindful of balancing sort of the requirements that we normally have round about the regulatory processes, but also our role in ensuring that we've got a vibrant and vital city centre when we emerge out of the coronavirus situation, pandemic that we find ourselves in. So it is a balancing act, but I would like to just take this opportunity just to remind everybody that's sitting with a temporary building warrant that, you know, that date of the 30th of September will come around very quickly, and the team are writing out to everybody just to remind them of that, but also to make sure that you know, we have plenty of time to make sure that those structures are safe for the winter months when we have quite different potential weather effects as opposed to just the summer, although in Aberdeen you can never really guarantee that.
Okay, thank you very much, Ms. Beatty. Can I just ask, and again, I don't know if it'd be yourself or Mr. White, when we initially looked at the city centre and it's the sort of the spaces for people, and one of the drivers for that was that there was to be a certification for premises. Do we have any more information on the certification that was indicated by the Scottish Government?
So this was something that was brought up through trading standards and environmental health, and I'm sure one of my colleagues can jump in if I'm saying the wrong thing, but that was something that was discussed at the professional bodies round about the time of looking at reopening premises. So it was going to be a sort of a version of the national system that we've got in terms of the check that you're COVID compliant. That wasn't progressed at the time. So the sort of the drive to make sure that premises were given an actual certificate before they could open hasn't come into play yet. Although I think, as one of my colleagues said, we are obviously awaiting to see what the further guidance is going to be at the end of the week.
And the final point on that one was part of the certification included being able to queue or access the premises safely. And my understanding is because that generally was on public footpaths that fell to the council, is that right? In terms of making sure there was enough space.
So yeah, so the responsibility within the premises is obviously on those premises, but the council does have a duty around about the public spaces. So that is particularly one of the drivers for spaces for people. You know, looking at that public health message and being able to provide as much space for the opportunities for physical distancing as possible was really important as part of that process.
Okay, thank you very much. Chris, can I have you in there?
Thank you. So I've been listening to the conversation, and I've also been watching the comments coming up in the chat bar as well. So I actually went to the Scottish Government Resilience Committee last week when this was all being considered, and of course that as you said in your introduction, Councillor Boulton, that the Resilience Committee is meeting again today. In fact, it's meeting this afternoon just now. I think what I would say is that what might be different about Scotland is the government having an explicit goal of an elimination strategy. Scottish Government have been explicit in saying that their goal is the complete elimination of COVID-19 from Scotland, and actually that doesn't sound, that's not as ridiculous as it might first sound, especially the comments about, you know, that we see higher rates of infection over the border into England, particularly in the north and centre of England. But we have to remember that when we were in July, there were actually 2 days in July when there were only 2 new cases of COVID detected in the whole of Scotland. The way in which the Scottish people got behind the original lockdown, it had a tremendous effect in terms of really bringing our numbers right down to such low levels. And in fact, here in the northeast, we had 11 days in July where we did not have a single new case of COVID, which really brought the levels right down. So I think first of all, there's the elimination strategy, which played a really important part in making these decisions. Second of all, that nobody was under any illusion of the public health harm of bringing in a local lockdown, and indeed myself, colleagues out in public saying, on record saying, that we absolutely need all of these measures that Steve and Gail are pointing out. The very reason we need all of these messages, actions, was to prevent this very thing from happening. The risk of a local lockdown for anywhere is so high, but so potentially harmful and catastrophic, that we need to do everything that we can to avoid it at all costs. You don't need me to say, but just to acknowledge. I mean, this is your livelihood. This is your income. This is what pays for your for your workers' children to be fed. That none of this can be taken lightly. The last thing that any of us want is for this lockdown to go on any longer than it needs to, or for it to be, for it to even be needed in the first place. So I think in terms of the decision making around it, it really did circle around the numbers. And what we were actually seeing last week was a doubling in numbers. In fact, between the Friday and the Wednesday of last week, the cases had doubled and doubled again, and actually continued to increase up to the Thursday, at which point they plateaued, and we're now beginning to see the case numbers beginning to come back down. So what I'm fully expecting that my colleagues, both NHS colleagues, but also local government colleagues, as well as the national colleagues and agencies that are in and around this, that's exactly what they'll be presenting today, that actually what it looks like is that we hit the peak sometime towards the end of last week, and that things are coming back down. I don't know what the Scottish Government position will be as SCOR, and I'm waiting to hear from the meeting with great interest to find out what the decision was. So I just think that that's the context I think that we're operating against, and when this is lifted, that will remain the context that we're operating against. That we shouldn't think that just in the same way as we had one lockdown, that was past, it wasn't going to happen again. Just because we've had one local lockdown doesn't. But I mean, I think government have demonstrated to us that they won't hesitate to suggest that that's the way that these things need to be dealt with. We need to keep that at the front of our mind. Lastly, if I may, just in terms of oil and gas, again, we had very early conversations. Oil and Gas UK are part of the Local Resilience Partnership, and ourselves, NHS and Aberdeen City Council, Public Health, Environmental Health, we had very early conversations and ongoing conversations with UK Oil and Gas, just in relation to just exactly that point. How can we, workers coming up from down south or indeed anywhere else in the world, making sure that they isolate while they wait for their test result, making the point that if they're out and about socialising, that increases the risk that they'll be exposed before they go offshore, and of course the calamity that there would be if we were to have an outbreak in an offshore installation. So just to assure people that we have had those conversations and done work in terms of the messaging that UK Oil and Gas are doing with their employees. Thank you.
Okay, Chris, can I just, while we've got you, because there was again another sort of question that came through some of the themes, and that was about when individuals get their results, if you like, if they've had a test, and if it's somebody who works offshore, whether they've come onshore or going offshore, there has been concern raised that the result is the ownership of the individual, rather than, even if it's been paid for by the company. What's your understanding? I mean, I'm not sure about what the situation is.
So I think in terms of what happens, so it's a medical test. So medical tests are confidential. So you have you go and get you can go and get a medical test. Then the fact that you've had a test is confidential between you and your healthcare provider. However, the Public Health Act contains legal provisions that laboratories and medical practitioners have to notify identified infectious diseases. And COVID-19 is one of those infectious diseases that must be notified. So what happens in effect is the system is built around the lab results. As soon as you go and get a test, when the lab reports what your result is, if it's positive, it's automatically and electronically reported into the public health system. So yes, it's confidential to you, it belongs to you, it's a medical test, but the public health legislation means that result, positive result, comes into the public health contact tracing system.
Okay, and nothing to do with that, but on a slightly different theme, but you might be able to shed any light. We've heard about, all the premises taking lots of measures, and I think, we do have to respect that the premises did take lots of measures to be able to protect their patrons. However, we have seen the outbreak. But, there's obviously been a concern by different types of hospitality that, if they're a smaller premises, they're less likely than a larger premises, and, restaurants should be allowed to open or cafes should be allowed. What's your kind of view or understanding of this kind of question? Because clearly it's causing huge divisions amongst the industry.
Yes, I do see that. So certainly the information that we discussed was what was in terms of cases reporting contact initially with licensed premises. I know that there has been that some of our cases have identified that because people were getting on with their lives, people spoke about being other premises as well. I mean, the primary concern, the primary focus did seem to be around licensed premises. The mix of alcohol, I suspect, just being part of the challenge. Although, I mean, the point being made in the chat bar, why has it happened in Aberdeen and not happened anywhere else? So clearly, the fact that we've not had outbreaks anywhere else demonstrates that it is entirely possible for the hospitality trade to work and to work safely, because we're seeing that over the past couple of weeks elsewhere in Scotland. To be honest, I don't know. In terms of easing restrictions, I mean, I can sit here. I'm sitting here on my sofa at home. It's easy for me to sit here and say, well, that makes sense to me. I could see how you could lift the restrictions from cafes or restaurants before you do it from licensed premises. But clearly, I'm sitting here. I'm not in that meeting, so clearly it's not me that's involved in that decision. I think I can see the rationale. I can see what people are saying about it. I think we wait with interest to see what comes out of that meeting today.
And just kind of expanding that point slightly further, in terms of the 5 mile lockdown, again, some people have questioned the sense of that. Now, obviously, from a medical point of view, you might be able to, again, give us a reason why that was felt necessary.
So I think remembering the speed at which all of this happened, and remembering, of course, that the measures that are in place to protect us all are essentially the physical distancing, enhanced hygiene, face masks, etc., all of that, and then test and protect. So let's do all the precautions. Put all of those in place, and then if the worst happens and somebody becomes infected, let's make sure that they know to self-isolate, get medical attention if they need it, and all of their contacts isolate as quickly as possible before it gets a chance to spread. We know that that's the case. We know that because of the concerns about I mean, I know in absolute terms it looks like relatively small numbers. We're talking a couple of hundred cases now, compared to what things were. In the olden days of April and May, those are in absolute terms are small, but compared to a third of the month with no cases at all, I mean, this happened all very quickly. And so the decision to put the population measures in place happened very quickly as well. The thinking behind it was, if we've got a problem associated with the nighttime economy in Aberdeen, close the nighttime economy temporarily, and then stop people then displacing that activity into their own homes. So prevent people being able to then have parties at home, so to stop households being able to meet with one another indoors. And then the concern so that people then didn't just move en masse into Aberdeenshire and visit pubs in Aberdeenshire. So there was part of it was about saying to people not to then go out into the Shire for leisure purposes. But it was also about, of course, there was also the message to people, although this wasn't travel restriction, but the message to people, don't come into Aberdeen for leisure purposes.
Okay. Thank you very much, Chris, because I know for a lot of people, Steve, I notice, Steve Bothwell, you've got your hand up. Do you want to follow up on that?
Can I ask Chris a couple of questions?
Certainly.
I've been listening very carefully to what he's been saying from the very start. I'm really uncomfortable with hospitality businesses being they're a target at the moment in the public side. The public, see a name mentioned, and it kind of goes round the houses about 1 million times. When you said that if you're investigating a couple of cases in a pub, for example, the Hawthorne Bar, and you have to, and there was more cases and more cases that you've really got to do an in-depth investigation of where all these people have been. Why is it that these premises, there was 28 the other day, being publicised in the local papers? What is the point of those businesses being publicised when you are saying that you've got to investigate other options, so many other options? Because it seems deeply unfair that we can't physically, we can't know if somebody's got COVID-19 when they're walking through the door.
No.
And we can put millions of measures in. We can sanitize a place, till the cows come home. But we can't stop an infected person coming in because we don't know they're infected. So at the moment, there's a kind of hardcore focus on hospitality, and I think that's deeply unfair. So why are they getting named and shamed in the local press? Because as we all know, the public will make a snap judgment.
Okay.
That's what the public are like.
Yeah, thanks.
So
Chris?
why is it being publicised?
No, indeed. So the decision to name the premises was so let me just lay it out. So the decision to name the premises was made against a very high level, as you know, a very high level of public concern last week. So we're in the middle of the week, the Wednesday. Government's making, Nicola Sturgeon standing up and making the announcement about the local lockdown at lunchtime on the Wednesday. We've got huge public concern. Social media is lit up with the phones, everybody's phone everywhere is ringing. There's lots of worry, there's lots of anxiety. The intention behind it, and hindsight is a wonderful thing, and we can have the conversation about, in hindsight, whether this was a sensible thing to do or not, whether this was the right thing to do or not. At the time, lots of people were worrying that just having been in a premises meant that they were somehow at risk. And we had a great run on Aberdeen Airport. And again, you may well know that, Aberdeen Airport ran out of tests. That they can test 860 people a day, and by very early hours of Thursday morning, they'd run out of tests because it was such a demand for people wanting to go and get themselves tested. So the intention, all I can say is assure the intention was well intended, in terms of just because you've been in a premises that are everywhere all over social media, people are naming these places all over social media. Just because you've been in one of these premises does not mean that you are at risk. It does not make you a close contact. You don't need to rush and get tested. I'm trying to bring a degree of calm to that. And the decision to name the venues at the time was there was a real worry that if the authorities didn't say anything about these venues, and I know it personally. I was being interviewed for the radio, and being asked, is there any other venue other than the Hawthorne Bar? And I was being very careful in terms of how I was replying to that, because what we were worried about was that if we, knowing that this stuff was all out there in social media, if we, the authorities, refused to say anything about the premises, the worry was that we would look as if we were trying to hide something, or we were being dishonest, or we were being less than transparent. Now, I hear what you're saying, though, Mr. Bothwell, in terms of the impact of that, in terms of reputation, in terms of the assumptions that people jump to. It was well intentioned in terms of saying to people, we know that these are the names that are out there on social media. Yes, if you've been there, just be aware in terms of looking for symptoms for yourself, but that doesn't make you an automatic close contact just because you've been there. Now, of course, what's happened subsequently, as the cases kept on increasing, And as we kept asking them the question in terms of, so where have you been in the time when you 48 hours before your symptoms developed? Of course, we've had more and more and more venues, names coming out to us, and our list has grown and grown and grown. And actually, I think so we up until now, we've made the decision, actually, we can't just keep expanding this list of venues every time somebody new tells us, oh, and I was in such and such a place. We go, well, that we haven't heard that one before, we better add that to the list. And I think exactly for the reason that you're saying, that while it was well-intentioned when we did it, and like I say, we did it for purposes of honesty and public trust, I think, in public authorities. At the same time, I think with hindsight, we can see exactly the concerns that you're raising, and that's why we haven't then continued to keep adding to the list, because we realise that none of this is easy, none of it's simple. That's why. That's my honest and sincere answer to you.
Steve, do you want to say anything? Yeah.
I've been spending the last sort of 6-7 weeks refurbishing the restaurant and creating a lot more space for the customers. But I have been really, really uneasy about the entire situation, especially just now in Aberdeen, when there's so much focus on here, like, you know, and I mean, I've run a restaurant for 25 years very responsibly and had no kind of licensing issues, no real kind of issues at all. And the last thing I want, you know, is the finger being pointed at me. I mean, I'm not even keen to open. I'm gonna be kind of leaving it for, I would say, at least another 3 to 4 weeks, because of the hoops we'll have to jump through with environmental health and all the rest of it, and there's an unnatural amount of scrutiny on hospitality, I think. We seem to kind of think that, you know, groups of people going to a bar will automatically cause a problem, or you know, people going to a restaurant and sitting down, as they have been doing for, you know, millions of years, are kind of somewhat risky. Why is the scrutiny not being shared to other sectors? Retail, train stations, trains, buses, airports, hermetically sealed aircraft where you've got a couple of hundred people sitting there with paper masks on. It's an unfair setup at the moment, I think. I understand everybody's concerned, and I understand that you guys want to sort of kind of nail this, like, you know, but closing down daytime cafes is just nonsense, like, you know. You don't get mentally crowded daytime cafes, you know. They're all kind of very much kind of, you know, laid back. You're sitting there having a cake and a coffee during the day. That cannot be a COVID hotspot, surely. I understand clubs, mentally busy bars, more so, but a civilized, well-run restaurant. But you know what I mean? I'm kind of, you know, I was hoping to celebrate my 25 years in business this year. Now I'm like that. No, I'm not, you know. Thank goodness I own my premises and pay the commercial mortgage. But a lot of kind of operators are going to be really, really feeling it right now. And I think, like getting back to what I'm saying, the kind of the scrutiny and the public, the health scrutiny, the public scrutiny on hospitality, you know. There's so many other kind of situations and environments that people could be catching it and, you know, spreading it right under our noses that we don't know about, like, you know. Anyway, rant over.
Thanks, Steve. Chris, do you want to respond to any of the last few points of Steve's?
So I mean, I hear the I hear the plea in there for a bit of rational thinking and a bit of proportionality in terms of response. I mean, what I would say is, let's be under no illusion that when this was all kicking off, we were managing that locally, but the scrutiny, as you say, is such that it was a matter of days before Scottish Government had set up their resilience room to look at this. That is that. I mean, they are literally, our ministers are literally looking at every positive case that comes through, because what they absolutely want to make sure is that as a country and as a system that we are on top of every single case. I mean, the scrutiny really is incredible. I know that the previous large sector that I think was in the eye for that was the care home sector, and I know that for a lot of care home providers that they also felt a whole variety of the kind of emotional response that you've just set out there in terms of their businesses and the scrutiny and the attention that was being paid to them. I wonder that the next sector that will be really under scrutiny, of course, will be our schools. Now, like I said, I mean, I think we need to take heart from the fact that other parts of Scotland are operating their nighttime economies and their hospitality sectors without any apparent problems, and that they're managing to do it. It tells us then that in principle that this can work. So, I mean, my heartfelt hope is that we just get through this as quickly as we can. The numbers are coming down in the right direction. That'll be what's been fed back to government today. I think the hope has to be that we get back on track as soon as possible.
Okay, thank you.
Thanks, Steve. Can I just ask Chris another kind of comment around the same element was about there's been a number of pictures circulating, obviously like there was for Aberdeen, but of other cities in Scotland where there's been queues outside premises. And like you, I did an awful lot of radio interviews last week, and callers were coming in behind me and saying, there's no social distancing in Edinburgh, there's no social distancing in Glasgow, but we seem to have, does it just take one case that can kick it all off? And, I think people are just scratching their heads.
Has it been an element of bad luck? I mean, so in terms of what I was saying about the days in July where Scotland only had 2 cases in the whole of Scotland, that background risk of somebody being unknowingly infected and taking it into a setting against that kind of level of risk was obviously very low. Have we just been particularly unlucky in Aberdeen? It is a possibility. Is it to do with Aberdeen being particularly more international because of oil and gas? I don't know. I'm not hearing that from the analysis at the moment. Have we potentially been unlucky? Potentially, yes.
I mean, and the final question, you'll be feeling that you're getting them all, Chris. But the other comment was, how does the NHS, the police, and Aberdeen City Council feed in to the Scottish Government in terms of our views on whether things should be lifted? I mean, how much weight's given to our comments, and who's got the final decision? I suppose our biggest input.
Yeah. So I mean, I can see Mr. Glover's comment there about lobbying Scottish Government. I mean, I think as a public servant, I certainly wouldn't describe what I do in my job or what my colleagues do as lobby anybody. So I think our responsibility from NHS side, and I would expect the same for officers within the council, is to present the facts, is to have systematically and transparently gathered the information required to set out the situation, to allow a rational analysis of what's actually happening and what the trends are and what the direction is likely to be. I think that's my job, and my colleagues' job is to set that information out to inform decision making, and that includes highlighting, as I say, which we have done in a number of discussions. That and to be fair, didn't need to. That actually none of this is cost free. That there is harm from these kind of restrictions. We know that there are. So we've certainly made sure to articulate that, our awareness of that. In terms of how much weight does that carry, it's part of the evidence. It's part of the evidence, and it's part of the decision making.
Okay, thanks very much, Chris. Steve, I'll let you have the last word.
Sorry, me again. Chris, can you hear me okay?
Yeah.
Going back to what you were saying very, very quickly, Are you saying that you will no longer be publicising the venues if somebody gets infected?
So it's a day by, so the incident management team, which is managing this, and that incident management team will convene until there's a declaration that this outbreak is over. Is meeting on a daily basis, and what it does every day is review the latest information, the latest numbers, the latest data that's available in order to make a judgment. Now, at this point in time, the decision up until now has been to stop adding venues to an ever-growing list, not to do that. Now, that's not to say that if some other premises is associated with an outbreak, one of our cases or more of our cases go off and seed an outbreak in some other setting, that venue might not be named. So whatever that venue might be. So I can't say that no premises will ever again be mentioned, but at this point in time, the decision that's been made is we're not going to do that just by default. We're not simply going to just keep naming venues just because people are giving us their names.
Thank you very much.
Again, that was something that was brought up, and I know that you and I have already had a discussion on it, Chris, where there's been a number of venues that have contacted me where they feel that by being named, that it has kind of stigmatized them, and they felt it was very unfair for the other venues. I see, John, I'll take you, and John Wigglesworth.
Hi, Mary. Can you hear me?
Hi. Yes, we can. Thank you.
Thanks a lot. I've been listening, to everything that's been said, and appreciating all the comments. And I'm not going to, start making, making any statements about who should have done what. But it's really just a simple question. And I also understand that the Resilience Committee directs, or appears from what we're being told here, directs what questions they ask to agencies in Aberdeen. But it's simple. We're a week in. We're not doubling anymore. Cases are reducing. Is any part of the local decision-making process or the local health or governing sectors making any recommendation to the Scottish Government that it is a reasonable action to lift the lockdown on any area of the hospitality? Thank you.
Thanks, John. Chris?
And what I need to say is I can find that answer out. So I wasn't at the incident management team today. I'm not at the resilience committee. I don't know what they were taking from the incident management team into that in terms of what recommendations they were going to make, or indeed what recommendations they were going to be asked for. But I can find that out, and I can communicate that through Councillor Boulton.
Okay.
Thank you. I just find it, just as an observer, we can't get involved in the clinical discussion for obvious reasons. We can't get involved in the political discussion because that creates many issues for us as businesses. But when you actually see, and we're talking about the Scottish area, but when you're seeing the north of England operating in lockdown, which could be the same, if not worse than ours, with hospitality open, I just can't see our decision-making process, the logical reason for our decision-making process. So, I'm just trying to see where this goes, but we wait till tomorrow.
Okay. Thanks, John. Appreciate it. I'm conscious of time, and I don't know if Teams suddenly cuts me off or not, but I'd just like obviously to draw today to a close, and I really hope that people have got out of it what they needed. I appreciate that there may be unanswered questions, or there may be more questions from the questions that have been answered. As I say, our director, Steve White, is going to circulate an email to everybody that's registered today, so that if there are unanswered questions, Steve will be more than happy to meet with you or to facilitate some sort of answers. I mean, today's meeting was primarily about ensuring that you had the information to understand what your public sector partners were doing to keep the city safe, to try and help us find a way through this pandemic and out of this lockdown. This is only one part of what we're doing. There's other officers who are working with the Scottish Government at looking at financial assistance to be able to support the sectors and that are being impacted through the lockdown. And this is from the food producers to, you know, the premises themselves. We recognise, and I think as Chris said, that people have salaries to pay, they've got, you know, they've got bills to pay, they've got children to feed. So, you know, we want to try and do everything we can to support you. We've got environmental health who are also going to be running seminars because we know that there's more guidance coming out. So, you know, please make sure, and I think they're going to try and make it specific to different parts of the hospitality sector, to make it more relevant and to maximise best use of your time. So again, please go onto our website and you'll be able to find more about that. You know, where do we go from here? I think fundamentally we need to start restoring Aberdeen as a place that's safe. Our reputation has been, unfortunately, tarnished quite significantly. And I think everybody has actually contributed to that in some way or the other through social media. Now, I recognise there's tensions, there's anger, there's divisions within the hospitality sector, but airing our grievances through a social media platform or through the press doesn't help Aberdeen, doesn't help any of us. We're cutting each other's throat and stabbing each other, you know, and it doesn't help. We need desperately at this stage to come together to show Aberdeen has always led in lots of different areas of how to do things better. We've been really unfortunate. We've been caught through COVID-19, and I don't think it was genuinely deliberate by anybody. But we are where we are, and we have to find a way to move ourselves forward and to restore the reputation of our city, of our nighttime economy, of our restaurants, of our cafes, because, you know, they all add to the dynamics of this wonderful city. So I've been on the licensing board for over 13 years. When I first joined the licensing board, Aberdeen had a pretty poor reputation in terms of its nighttime economy. It was sort of akin to the Wild West. That was the reputation we had. But there was an absolute desire and determination by everybody to change that, to make it happen for the city. And it didn't happen overnight. I mean, it took years. But you know what? We did it, and we did it together because we all had the same goal, and that was to put Aberdeen on the map for the right reasons. Now, the council, the police, the health board, we can all do our bit, but we can't do it together. We have to be united in wanting to make this difference. I mean, if we look at, you know, the hospitality sector, and particularly the licensed trade, you know, we've done really well in the Best Bar Awards. We've won on a national platform. You know, we've got 7 years of a purple flag. We were the first council to get it, and we've retained it for 7 years. That speaks volumes. But it wasn't one person that did it. We did it together. And if we want to come out of this, and I genuinely believe we do want to come out of this, we have to put our differences aside, you know, whether you get together as different trades and obviously social distance, please, you know, have your say with each other, but do it behind closed doors. And let's provide a united front for this city, because I'll tell you right now, we won't come out of this lockdown if we keep criticising each other. And if we do, because we'll have had tarnished our reputation so badly, nobody will want to come here. We've got enough challenges in the city with the downturn in the oil, with the pandemic. Let's not make this another casualty. If we come together, if we stand united, and we can accept that we've got different ambitions and that, you know, that there's things that annoy us about each other, but we have to move forward. So please, if anything, I'm urging you, please leave your grievances behind. Let's recognise we were unfortunate, that we have the best intentions for the city. Let's make the difference we need to, and let's be held as exemplary of how to come out of a lockdown, not how to stay in it. So please, everybody, I hope you've enjoyed today. Anything I can do, I'm always available. Please feel free to email me at any time. Many of you do. And as I say, I hope you've got something out of it today. And I would just like to thank all those speakers from the public sector, you know, particularly our partners, for coming along today. I hope it's been beneficial. And I know that the Environmental Health are happy to make the slides available to anybody that wants them. So please, again, if you could drop Andrew Gilchrist, sorry, Andrew, an email, I'm sure he'll forward them on to you. So once again, I'll just close today and thank you all. The recording, if you could stop it now, Mr. Monroe.
Thank you.
Okay, thanks very much, everybody, and
Bye
good
now.
luck, and let's make a
Cheers.
difference positive.